if somebody gets the diagnosis of dementia, of Alzheimer's disease, or a form of dementia, how do you decide what medicines to use and what do the medicines do?
So in terms of how do we decide what form of dementia someone has, we have to do a history. The meat of everything is in the history, listening to your patients. What are your first symptoms? Then doing a physical exam, a neurologic exam, as well as cognitive testing. So looking at different domains of impairment. So are you having problems with word finding and aphasia? Are you having problems with executive function, like doing tasks? Are you having problems with orientation, the where am I? So we ask those kinds of questions. You may be familiar with the mini mental status exam, the MMSE, or a clock draw, drawing the face of a clock. Something that sounds simple, but it tells us a lot about how the brain's working.
And so when you take a good history, you can begin to differentiate the different types of dementia that occur, and that will determine what kind of medicines that you get. Give me an example of a medicine that's good for
So there are multiple medicines that are FDA approved, medications that are in this family called cholinesterase inhibitors. Basically, they effectively maintain or increase acetylcholine. There are 3 medications, donepezil, rivastigmine, and galantamine. So they're all very similar, but they're not the same drug, just like you can have blood pressures that are very similar in the same class, but they're slightly different, and each of those is ever so slightly different.
Do you ever use them in pairs? And if one doesn't work, you automatically go to the other? Tell me how you coordinate the medicines.
So in that class of drugs, we usually only use one. There is another drug called memantine, which works at the level of the glutamate receptors, and memantine works really nicely in conjunction with those other 3 medications. Think of it as being synergistic. Together they work better than one alone.
So when you put somebody on 2 medications, what can you see? How easy is it to see the improvement? Is it what people tell you or what you see when you retake the history?
So we'll retake a history, we'll do repeat cognitive testing, and many times it is nuanced. Remember, cognition, all of thinking, all of the brain is a lot more complicated than one little test. But what we see is a slowing of decline. And remember, if you can buy yourself time, a lot of us could tolerate a little bit of memory loss if we're still able to function in life.
When you're giving people medications for dementia, what do you see in that family? What I'm trying to pull out here would be stories of people that just a little bit of improvement really changes their life and changes the people around them, makes life more fun, more exciting. It must be a tremendous thing to see people improve on these medicines.
Absolutely. And remember, small improvements are huge. If you recognize your loved one, that can be life-changing. If you know that you're in your own home, that is life-changing. So I try to say to people, these medicines don't stop working. You shouldn't just take them for a year and then quit. The gains may be smaller, but still big to you.